My name is Heun. I'm a consultant psychiatrist and editor of Global Psychiatry Archives, and today I would like to talk about schizotypal disorder. And schizotypal disorder is seen as related to schizophrenia, but it's quite unusual, and it shares some of the features. In ICD-10, ICD-10 and ICD-11, it's classified as disorder related to schizophrenia. In DSM, the Diagnostic and Statistical Manual for Psychiatric Disorders, which is the American classification, it's seen as a type of personality disorder and in the group of eccentric disorders. So it's about 3% in the general population have some type of schizotypal disorder, or some call it schizotypal personality disorder. And in patients, it's a bit higher. In patients, 4 to 5%. And usually the reason why it's called a personality disorder, because the cause is very stable. So people might have the same symptoms over years and might not change a lot. And so it's seen as a partial expression of schizophrenia, the phenotype, but it doesn't have the delusions and not the hallucinations. Twin studies with people with schizophrenia show that there is an increase of risk of schizotypal disorder in relatives, and it's more common in first-degree relatives of schizophrenic people than in the general population, which always is seen as an indicator that there might be some genetic background. The symptoms are ideas of reference, so thinking that if someone does something, let's say someone gets into the bus or goes out of the bus, that has to do something with the person who has a disorder. So there's lots of social anxiety. There can be odd beliefs about the mafia or other thinking, magical thinking, that they have to do something specific to prevent something happening in the world. There might be unusual perceptions, so that there might be illusions that things which are possibly seen in clouds could have a meaning for them. And some have odd or eccentric behavior or appearances. Some have, I've seen people having hats which prevents radiation from the world, and sometimes they are with metal and they're made themselves, and sometimes people can look a little bit odd with that. Usually these people have a long history of these illusions and magical thinking and anxiety. As a consequence, they have very little friends or confidence. Sometimes they break with the family. Their speech can be odd, or use of unusual words or unusual pronunciation. And the affect or the mood is sometimes restricted and sometimes inappropriate. There's always this some type of suspiciousness that something is against, and sometimes there's some paranoid ideas that some people, or the mafia or the police, is doing something against them. The differential diagnosis, which is a diagnosis as an alternative, which might be something related to that, could be autism or Asperger's syndrome. It could be a language disorder. It can be the result of chronic substance abuse, or it could be related to other personality disorders. As we see very often, personality disorders are very often mixed, and the clear types of personality disorders as described in the textbooks sometimes do not reflect what can be seen in the population. So what can we do about that? Usually patients might profit from an antipsychotic, such as risperidone or quetiapine or olanzapine, or even aripiprazole, which was one of the newer ones. There are some randomized clinical trials with risperidone, but the trials are usually small and inconclusive to the whole spectrum of antipsychotics. So CBT might be helpful, but very often it might also be helpful to help people in their social situation, which might be very restrictive, and people might struggle to cope with their lives. So there are different ways of helping, but sometimes the people having this disorder are struggling in society and have a very chronic course of their disease. I hope this information helps and give you some insight. This is what we want to do as part of the Global Psychiatric Association, make people understand what happens in the world of psychiatry and mental health, and maybe to help other people who are suffering. Thanks for your interest and have a nice evening.